an important event, and we are going to be able to see trucks going through here all day as we prepare for the second part of the COVID epidemic. My colleagues will talk to you in just a minute about what we're planning to do, as well as the effort today. We have our Director of Director of Emergency Planning here. But the main thing I wanted to say here today is that, here we go again, but it's maybe a little tougher this time. The first thing we are noticing with the spike in the numbers is that where last time long-term care facilities were our problem, this time they're doing very well. It's the general public who's having trouble. And in general, they're having trouble because they're probably tired of all this, and they're having private events, private parties, after-school parties, and those events are where we are seeing the bulk of the increase from. So our major message today is that we've got to hunker down, put our masks back on until we can get through this part of the COVID epidemic. I'll turn it over now to Commissioner Harvey.
Thank you, and thank you all for being here, as Commissioner Marseglia said. We all know all of us are tired of wearing masks. We're tired of the interruptions to everything we had planned. We're tired of postponing graduation parties and weddings and other events. And we're definitely seeing this COVID fatigue and the impact it's having on our numbers. Commissioner DiGirolamo can touch on some of the specifics, but we're seeing record numbers in terms of cases. Thankfully, our hospitalizations are not going up. We certainly hope that remains the case. But we are seeing, as Commissioner Marseglia said, spikes coming out of family events, family parties. We're seeing weddings. We had two situations involving two different high schools in Bucks County. In one case, there was a Halloween party among students, and that's led to a spike in cases. In another case, there was a big football game, and afterwards, players and kids from the winning team decided to get together and celebrate, and that led to a spread among them. Interestingly, the schools, we are seeing no spread within schools themselves. The hybrid, or even the ones that are in person, we have not seen spread, and certainly we're very, very hopeful that stays the same. So to thank the school districts, all the schools that are in operation, daycare centers as well, for all their hard work. Businesses and restaurants are doing their part, and we're seeing them really helping to maintain control of this, because we're not seeing as much spread there. But it really is these family get-togethers and parties, having friends over to watch Eagles or whatever you're doing. We really just ask you to be careful of that, and especially if you do not feel well, don't go. We are seeing people who went to a wedding and they thought, well, my throat was a little sore, but I didn't really think it mattered. And they ended up testing positive, and then other people from that wedding get positive. We are seeing coworkers who are not feeling well going to work and then sitting down having lunch with coworkers, and then it spreads among them. So all the things that are very, very easy steps to take are the things that can help us. And so we're really asking the public, we know it's difficult, please just keep wearing the mask, keep following social distance, keep the discipline we've had that helped us get numbers down, because they're going up again, and we really, really, really want to make sure we can go into this holiday season and have some, at least some normality. But it's going to be difficult to do that if the numbers keep spiking. So at this point, I'll turn it over to Commissioner DiGirolamo.
Thank you, Bob. Good morning, everyone. The county put a press release out this morning, and I just want to read a little bit just to show you the scope of the problem that we're dealing with. And there is a little bit of good news in the press release, even though the numbers are going up. The County Department of Health reported 826 additional infections from November 1st to November 7th, an average of 118 cases a day, a 79% increase. I'll say that again, 79% increase from the previous week. The county also set a single-day record with 161 new cases on Friday, surpassing the previous high of 144 cases on April the 15th. There was, and this is the good news, however, not a corresponding increase in deaths and hospitalizations. And, I think that's important to remember. So the message I would like to get out is that we still have to be careful. We still have to use common sense. the virus is still out there, and because of the low number of deaths, thank God, and every death is heartbreaking and tragic, because of the low number of deaths, it's obvious that it's not in the nursing homes and there's not older people with pre-existing conditions getting the virus, that it's more young people. And per a conversation with Dr. Damsker yesterday, he says the schools that are open full-time, he says they are perfectly safe. As a matter of fact, he said the children are safer in schools now, going to school in a structured environment where they're wearing masks, where they have face shields, where the teachers are watching out for them. They're safer going to school than they are staying home and doing virtual and being out in the neighborhood and playing with other kids. So the schools are safe. He says our businesses are all safe. There's no sense in making any new regulations or curbing businesses and what they're doing. Specifically, he said about restaurants, that they're not seeing any cases of COVID coming out of restaurants at all, unless you're there eating at a table with a friend or a relative who have COVID and you get it from that person. So I think, again, we've got to use common sense. The cases are spiking, but the deaths are not going up and the hospitalizations are not going up. So the message continues to be, please wear a mask all the time, and please continue to social distance. And be very, very careful about social gatherings, families and friends, weddings, all that kind of stuff, because that's where the cases are spiking, on social gatherings. So we have to be careful, continue to be diligent, and I congratulations to Dr. Damsker, and you're going to hear from Scott here in a minute for the terrific work they are doing with their staff. So thank you very much.
And just to reiterate from Dr. Damsker as well, we are not seeing cases mask to mask, so that is the one thing that you can do. People worry a lot about, are we going to shut down again? Are we going to close businesses? There is no reason that we will have to do that if everyone is wearing a mask. So the importance of masks, another PPE, I would like to introduce Scott Forster, our Director of Emergency Management, who can talk a little bit about today's project.
Thank you, Commissioners. Good morning, everyone. As you heard from the Commissioners this morning, our cases are starting to elevate. We are starting to see more community spread, more household spread. So our planning efforts are starting to rise as our cases start to rise. The County Health Department and the Emergency Management Agency and all of our supporting departments have been working together continuously with our efforts to work with the school districts, the nursing homes, the personal care homes, the municipalities, and our specialty care centers. And in order to ensure that our first responders are safe, that our healthcare workers have the PPE that they need, today, yesterday, and this Thursday, we are doing a large PPE, personal protective equipment distribution. We have ordered hundreds of thousands of pieces of personal protective equipment that range from N95 masks and surgical masks, gloves, face shields, disposable gowns, all of the things that would protect our emergency responders and our healthcare workers to take care of folks. We have worked tremendously hard with our nursing homes and our personal care homes to ensure that not only do they have PPE, but we've provided training for them. We provided other guidance in cohorting of patients that are positive with COVID. We have worked with an organization called the RICP, which is the Temple Hospital system here in Bucks County. It's a contracted arm from the State Department of Health that goes out to the nursing homes and the personal care homes, and we accompany them on many of those visits. We continuously try to ensure that the residents of Bucks County are safe, our responders are safe, and the only way that we could do this is together. We're providing all this PPE for our responders and our healthcare workers, But what's also important is what the commissioner said, is to ensure that the general public are wearing their masks, because we're doing all of this planning so that if we see additional hospitalizations or if we see significant spread in our custodial care facilities, we're prepared. But we need to make sure that we are not contributing to those cases that end up overwhelming hospitals and getting into those personal care homes and those nursing homes. Thank you.
Do you have any questions?
So obviously wearing a mask is the best way, but how do you ensure that people wear masks since it isn't illegal not to, obviously, in the state? How do you kind of really make sure people stay doing that?
So we do have a requirement that people should be wearing face coverings while indoors. We have a requirement that we should stay 6 feet apart. But what I will say is, just to protect yourself and the fellow people that you are around, we should be wearing masks. And if you can't wear a mask, we also have face coverings. We have face shields or other types of things that you can put over your nose and your mouth to ensure that you don't spread the COVID virus or contract it, because we need to make sure that we are protecting each other. So when you go out of your house and you're going to a restaurant, or you're going to a business, or your children are going to school, or wherever you are going, wear a mask.
Are we to the point yet where we're talking about stay-at-home orders for 2 weeks or so, business shutdowns? Are we there, or is that avoidable?
So we are absolutely avoiding that. There's no reason we have to do that if everybody wears a mask. But in answer to your first question, and Commissioner Harvey wanted to say something too, one of the reasons that we really need you here and to get this word out is that this is the second wave. And even in the first wave, we had some people not believing this was real. So it's almost like we've got to start all over again, and we've got to re-educate all those people who were resistant to believing that this was a real disease and that they should wear masks. So we're back at day one again, and we're hoping from things like this we can re-educate those people. And Commissioner Harvey wanted to say something.
Yeah, and we're still obviously in a public health emergency, and just we were getting questions in the springtime from business owners when they did start to open up about what their authority was if somebody comes into their business and isn't wearing a mask. Business owners are completely within their right to refuse service to somebody who's coming in without a mask. They need to protect themselves, they need to protect their employees, they need to protect other patrons of that establishment, what kind of business it is. And so that's something else that, business owners are completely within their right. Put up signs. We have signs on our website, the economic resources page on our buckscounty.org website that they can just download, and print out and make as many copies as they want. They don't have to reinvent the wheel. But they are completely within their right to do that. Certainly we believe that, the problem isn't coming from businesses as much as it is just people getting tired of wearing the masks and coming out of, going out of Halloween parties and other parties and things of that nature. So we just need people to sort of, buckle down and just get us through the next couple of months.
We still have people from the spring who say this was just a problem in nursing homes and long-term care facilities. This wasn't a problem in the rest of the population. Now we're not seeing the hospitalizations or the death numbers, so people are saying, I don't need this anymore. I don't need to listen to these things. What do you say to them? How do you try to get through to them?
Well, I think the first thing is they're wrong. And this is why you're here today, is because it can end up back in those facilities. We learned how to deal with them by limiting, the public's access to them. But that isn't really fair. I have a mother in a nursing home. It would be nice if this would pass so that I could go and visit her on a regular basis. That's our goal. So that's why it's under control in those facilities and those programs.
I mean, we all have masks on today, right? I mean, everybody's wearing a mask. And it affords you, by wearing that mask, a certain amount of protection from somebody that might have the coronavirus. But I think it's important to remember, because there are so many young people, the numbers here, not only in Bucks, but across the state of Pennsylvania, who have coronavirus but are asymptomatic, which means they might not have any symptoms. And when that person is wearing a mask, even though they don't know have coronavirus, they are affording protections to everyone around them, their family, their friends, their co-workers. So I think it's important to keep that in mind, that that's how we're going to keep the number of positive tests down, by everyone wearing a mask. It's so important. It really is. It's so important, and all the medical experts, all the doctors around the country and in the state of Pennsylvania, they all say the same thing. Please wear a mask when you're out in public. Do it for the public and your family and your friends and your coworkers.
A question about
You're saying that most of these are coming from these mass gatherings, right? Especially around the holidays. Thanksgiving, just a couple of weeks away. A major holiday where it's all about family. What are you saying to people that are still trying to make something work over the next couple of weeks? I mean, are you saying cancel all plans, or is there something that they can do?
I don't think we're saying cancel all plans. We're saying, I guess, trim the plans back a lot. You know, maybe we'll have a day like this and you could have your Thanksgiving outside. It isn't so awful to be around your family and wear a mask if you're protecting your family. I mean, this is actually an act of love. So, and the other thing is, you know, you could do a virtual Thanksgiving. There's all kinds of ways to do this year. You're going to need to get creative and show your love in a different way.
To follow up on that, I'd like to reiterate what Commissioner Harvey said earlier, is that do a self-assessment. If you're not feeling well, if you have any flu or cold-like symptoms, even if you have just a headache, maybe you don't go to your family function. If the family functions are not canceled or limited in the number of attendees, do a self-assessment. And if you're not feeling well, don't go. You would not want to expose your family, or especially even any of the elderly people in your family, to the virus. So stay home if you're sick.
The press release from yesterday mentioned that the county's contact tracing efforts got overwhelmed with the recent spike in cases. Dr. Levine said yesterday that they're seeing fewer people cooperate with them. I was curious if the issue with contact tracing in the county, is that due to the volume, or are people not participating?
We've always had a small percentage of people who just didn't want to participate, but our contact tracing here in Bucks was really the most intricate in the state. We're very proud of what we did. We were contacting about 97% of people who were testing positive, and that really gave us, we started that in March, that gave us a tremendous amount of data that has been able to help us formulate our way of informing people, fighting back a little bit against this virus, figuring out exactly how long people need to quarantine in terms of when symptoms kick in. We learned a lot about the epidemiology of this virus through our contact tracing. At this point, we know all of that information, and so while we still want to contact trace so we can kind of notify the people, the problem we're having is the numbers are getting overwhelming. It's simply not so much a matter of people not cooperating as it is we just physically don't have the ability to contact that many people. And so really it's another ask we can give the public. If you start wearing masks and you start really paying attention to how you feel and limiting your travel and limiting your exposure to others, that will bring numbers down, and that will help us do the contact tracing that we would like to do to help other people. Well, contact tracing is a very intricate system. It's not something you can train anybody to do in a short amount of time. The people we have are trained health professionals. We do have what's called a medical reserve corps, which is essentially retired doctors, retired nurses who have volunteered to help our health department. We've used them to an extent as well. So it's not like we can just put out one ads and attract people, because don't forget, everybody's going through the same boat with this. Philadelphia, Monco, the state itself. At some point there becomes a critical mass where you simply can't find enough people to do the contact tracing. Well, I think we did contract with some people to get them in to help us, but at some point, like I said, you just run out of trained people who can do this, and we don't want to pull people off of doing it to train other people to do it, because it is something it takes really kind of weeks or months to do. And did see Dr. Damsker is actually here. He was on a phone call with our local hospitals, which is why he wasn't here when we started. I don't know if he wants to jump in and talk about contact tracing. Dr. Dave Damsker, our public health director.
Thank you. What was the specific question? Yeah, overall, the issue is the system of contact tracing and case investigation the public health does for this disease and other diseases was never really meant for this number of cases. We were proud of ourselves here in Bucks County. We contacted every single case through the very beginning of this up until last week. And up until a few days ago, we were able to contact every case and do as much investigation as we could, contact trace. But the numbers are growing in such a way, these numbers are actually in excess of what we saw in March, April, May. And these contact tracing is even more difficult because back in the spring, a lot of our patients were nursing home patients where they didn't go anywhere. They were in a nursing home. Or people were in a lockdown and they weren't able to, they didn't have a whole lot of places to go. Now that people are up and about doing their basic normal thing, and schools are now back in session full time, it makes everything more difficult to do. And as Commissioner Harvey was saying, and I just caught the tail end of that, having case investigators do things, it's not easy. People ask a lot of questions when they first heard about a diagnosis, about their family, about quarantine isolation, and it takes a long time to properly train someone in that. So just saying we have 10 more people to make phone calls, if they're not giving good information, it could actually be bad information. So what we've been forced to do over the last couple of days, including today, is prioritize some of the cases. We're certainly focusing on long-term care, on elderly people that can get sick, on our school systems, and then we try to work our way down to get to as many cases as we can. And we're hoping that we can get to all of them, but we don't anticipate that we'll get to every single one. And I think that's important to know, that again, contact tracing was never designed in the bulk number this was. It was designed for if you have a case of measles and the person went out to eat somewhere and you say, okay, where did they eat? What was the thing? It was never meant to contact trace hundreds or thousands of people on an ongoing basis. And we don't know what's going to happen with these numbers exactly. These numbers are certainly, again, as I said, the highest numbers we've seen since, ever. I mean, the state has the highest numbers. So what I can tell you is that we're working really hard to continue the fight and to continue to educate the public. But when it comes down to it, I firmly believe that in the end, it's going to come down to the public and education and people following the rules about masking and not having gatherings, all the things that they've probably already spoken about today. That's the real answer, because once it gets into a certain number of cases, again, contact tracing and case investigation loses its effectiveness. And it's not just the Bucks County Health Department, it's the state health department, it's other health departments around here and around the other. It's impossible to get done. We have enough trouble we have so many cases, we have trouble pulling them off the system to even print them out to give out to investigators. So this is a real spike. The good news is that overall our hospitalizations, remaining on the lower end. What the hospitals are doing now is that they're starting to admit people that aren't that sick, so they can give them remdesivir and other treatments. Where there's people in the hospital now that they're trying to do earlier intervention. So the overall severity of cases is clearly down. Because if you see the number of cases that we have every single day, our hospitalizations are just a small fraction of what they were in the spring. So I think hospitals, there's a new pattern where they're trying to do treatment a little bit earlier on the patients, and the thought is that if you get them earlier, they won't end up on a ventilator. And obviously, what we've been doing has been working with the steroids and other things, because the numbers of hospitalizations we have are very, very few compared to the numbers of cases that we have, and the deaths we've had. Look, we're going to have a few deaths from this, unfortunately. We're going to have a handful of deaths every month, maybe a few more, a few less, because there's still people out there that are susceptible to this virus, as they were in the spring. But I do think our treatments are better, and I think overall the picture, while it's not great to be in the middle of a surge, I think it's certainly better news than it was in the spring, where we feel like we can treat this better. The overall burden of illness is less. The severity of the illness is less. Yes.
If the severity is less and the burden is less right now, for 8 to 9 months people have been wearing masks, and we at one point in Bucks County did flatten the curve. So if you're saying that a lot of the contact tracing right now is coming from home where people are not wearing masks, if they're forced to wear the mask outside and in stores everywhere, wouldn't you think that they want to keep the mask off when their economy is comfortable? So how can you ensure that, one, people are even wearing masks inside, and two, that it's even going to be effective, and three, you've announced that, I think everybody did, there would be a second resurgence. Do you anticipate the third? And then how long will the mask wearing continue?
Yeah, I think the mask wearing is something we should be doing for the foreseeable future. You make up a good point. I mean, if a husband and a wife, if one of them gets sick, if they keep sleeping in the same bed together, the likelihood is one's going to give it to the other person. And a large portion, between 2/3 and 3/4 of all of our cases every day are either household contacts or close social contacts. There's no question about it. If you're sick at home, if you can manage to, even if you don't know you have COVID yet, maybe you can sleep on the couch, sleep in a different bedroom until you're tested.
Do you really
Yeah.
think people are going to do that, though?
Not everybody, no.
Not everybody.
No.
Now, somebody earlier had said 10% of people, so that about 10% weren't wearing masks, but a small amount of people weren't wearing masks, and getting confused, and a lot of people are confused on it. Do you really believe people are going to wear masks in separately beds?
Well, certainly they should be. If one has COVID, I would hope that they are.
No, but
isolated.
you just said, even
yeah.
if they weren't feeling sick, you just said that.
No, it's if you are feeling sick, but you don't have COVID yet. I'm saying if someone has a runny nose and they don't feel well, there are people that would say, hey, as soon as I'm not feeling well, I'm going to sleep in a separate bedroom from my.
Isn't there a 14-day timeline where you may have no symptoms and be asymptomatic?
Yeah, there's people that could be asymptomatic. Yeah.
So how is any of this going to play out in the extent?
Well, a lot of our cases that are spreading it are actually symptomatic. We don't see a lot of people that are totally asymptomatic spread it. We see people sometimes that are pre-symptomatic, meaning I go to a party tonight and I'm feeling good, and then tomorrow I wake up sick. Those people definitely can spread it. But those that test positive because they're having surgery, that were tested for whatever reason, they're going to Maine, and those people that test positive that are asymptomatic, we don't see any spread in those households.
Okay.
So it's the people that are actually end up getting sick, whether it's the day before, whatever they're tested, those people definitely can spread it. But those that never develop any symptoms, we're not seeing a lot of spread from those people.
We've seen that hospitalizations and deaths tend to lag 2, 3, 4 weeks after. With the numbers that we're seeing that you're seeing from last week, are there preparations being taken now? And I know you mentioned treatments are better, steroids, those kind of things. Are there steps being taken now to prepare for what could happen in the next month?
Yeah, I think all hospitals right now are looking at their the surge. Remember, the good thing about what happened in the spring was all 6 hospitals in Bucks County already put into place their surge plan. So it's very easy for them to go back and reinstitute. If they have to do a special COVID unit, they can easily do that. If they have to open up a secondary unit that was closed over the last few months, they can do that. They already did it not long ago. So all 6 of our hospitals are currently planning on how to get additional beds if necessary. I know that their ERs, having just spoken to them, the ED visits and some of them are getting back to where they were pre-COVID. So which is good for them. I mean, they having 5 patients in the hospital is not good for any hospital, right? From a financial perspective. But in essence, a lot of the hospitals are seeing basically what they would see in maybe a normal November, as opposed to what they've been seeing over the last 10 months, which was a decrease in hospital visit, in ER visits. So I think in a lot of ways, and again, as I said, they're admitting people with a little bit less severe symptoms than they normally do because they want to get them on the medications. I think that may be the trend going forward is, hey, we have a few extra people admitted, but they're not as serious. I believe, we have 2 people that are ventilated in Bucks County residents that are ventilated. That's a pretty good number, not for those families, God forbid, but for the overall numbers compared to the cases we have, compared to the hospitalizations have, compared to what we had in the past. The overall numbers are much, much better. And so even despite the cases being higher, I think people should take that as a dose of positive news, and no pun intended. That the average person, whether it's, we've had 1,500 kids test positive in Bucks County. Not one's been in the hospital, right? Doesn't mean it won't happen or it can't happen. But we've had lots of cases. We talk to people every day, and they say to us, "Oh, that's all COVID was. Oh, I only had a headache. I had sinus pressure. I had a cough. I had a sore throat." So the vast majority of people with COVID do really, really well. I think that's important for the public to hear that, is that despite the numbers of cases that we have, almost everybody's doing great. Now, it doesn't mean somebody won't, and obviously there's a few people in the hospital, and things can go south for anybody. If you're older, if you're over 85, certainly there's a problem. People that are morbidly obese, that's one thing that we've definitely noticed in our people that aren't 85, that are younger. Being morbidly obese seems to be a real risk factor for developing serious COVID disease. So, if you're not in one of those categories, of course, there's always a risk in general, but your risk is much, much lower. And we can say that now, having been dealing with this for many months. And we talk to people every day that literally can't believe that that's all COVID was, right? And I think the more people that sort of hear that from their friends and families that test positive and say, hey, it's not going to be a death sentence for almost everybody. And that we doesn't mean we stop doing anything we're doing now. That's the one other point I want to get across, which has probably already been made, is that, regardless, we don't ever want to get COVID. There's no reason for anyone to get it, right? Because you never know who you're going to possibly spread it to. So continue to mask, continue to do all we can, and be smart. But if you do get COVID, it's not going to be the end of the world. And I want people to sort of take a deep breath. And now that we've had close to 11,000 cases, we can say that with some confidence. The overall mortality rate is very low for COVID. Yes. Oh, yeah, sure.
Just to follow up on the question about the hospitals being ready, that's one of the reasons why we're doing this today. We have all 6 hospitals in the county that are going to receive additional personal protective equipment to support their staff, to ensure that they have the numbers of PPE on hand that they will need. Also, the hospitals working with the health department and emergency management and working on their own to review their surge capacity plans and their plans for taking on additional patients into their facilities. There is a weekly hospital call with the leadership in the health department and emergency management that takes place, where we talk about everything from the types of cases we're seeing to the different initiatives that the hospitals are doing in the way of getting ready for COVID. So there is absolutely a lot of work going on in the hospitals, and it's been going on during the lull, so that when things would pick up and cases would increase like they are now, we're ready. But this PPE and that planning that's taking place at the hospitals are going to pay a lot of dividends in the next weeks ahead of us.
Thank you.